Okay, so today I want to bring on a guest to talk about something that can be in combination with osteoarthritis, is a condition that a lot of people, primarily women over 50, deal with. Some may have it and not even know that they have it. And this condition is osteoporosis. And I brought on my friend Rebekah to talk about osteoporosis, as she specializes in it and created a whole business on Pilates and osteoporosis and how to actually strengthen your bones and live out your adventures with osteoporosis. So Rebekah, if you want to go ahead and introduce yourself, and then we'll kind of dive into your story. But also, if you want to add in what osteoporosis is.
Definitely. So thanks so much for having me. This is very exciting and fun to be here to chat with you and with all your followers and guests. So osteoporosis is a condition of low bone mass, along with changes to the structure of the architecture that make it more possible to break. That is the simplest way to describe it. But I think the important thing is that it really is a metabolic bone condition. So technically, it's more than just, oh, you have low bone mass, because a lot of people can have low bone mass and they're not breaking. So a distinguishing element is really this increased possibility of fracture. That's the real concern about it. And yet that element of more than just low bone mass, the actual changes of the quality and the structure of the bone seems to have gotten a little bit lost in the wayside. But really the concern about osteoporosis is this greater likelihood of fracture, which, as you and I know, is so different, but has some correlations with osteoarthritis.
Absolutely. And I know that you kind of got into osteoporosis and created your business actually around your own story. And so if you want to kind of give us a little bit of an insight on your own story with osteoporosis.
Sure. So I was 28 years old. Let me back up. When I was 28 years old, I was a Pilates trainer. So I was training and helping certify other Pilates or other people to exercise or to become exercise professionals and Pilates instructors specifically. And so I already had some information about osteoporosis because I specialized in the injuries and conditions curriculum. So I knew some stuff about this, and I had been an athletic trainer in college. So I had worked in the sports medicine arena and such, was going to go to physical therapy school, didn't. And this was after my whole life as a ballet dancer. So I had this background, bring several things together, and I decided to take another course or workshop on osteoporosis to increase my knowledge. And I learned in that workshop that you build this majority of your bone density by the end of your teenage years. And that statistic changes, you hear sometimes 98%, sometimes it's stated 85 to 90% of your bone mass by the time you're like 18 to 20. And so because I had been a ballet dancer, and at those times in those critical years of formation of your bone mass, I had stopped menstruating, which is very common among high intensity athletes or sort of semi-pro athletes or ballet dancers. And as a result, I probably did not build up my peak bone mass. So I thought, oh boy, let me get a baseline now for later, especially menopause, when you lose a lot of this bone mass. And lo and behold, I found out, oh, your score on your bone density test is already at the level of osteoporosis, and you have the bones of an 80-year-old, but it's okay, you can just take some medication. And yet the medications had not been tested on premenopausal women of childbearing age. So I said, whoa, wait, let's pause. Let me find out what's going on. So that's how I first found out. And then I went to see, I worked with an endocrinologist and got the information that all the information that I now advocate everybody do as the very first step, because without that, I would have been going down a very different path than the one I did.
Well, and let's talk about that information to kind of gather, because I was actually just talking to somebody who was told that she had osteopenia and was literally given no other information. And so
Right.
she just kind of went about her life, and then it progressed to osteoporosis.
Right.
And so what are some things that maybe women should, or anyone with osteoporosis should be asking, or what is some of the information that they should be gathering, especially in the beginning of the diagnosis?
Sure. And just to clarify for your listeners who might not know, osteopenia is some loss of bone mass, but not to the degree that it's classified yet as osteoporosis. So in your question, there's a bunch of things. So first of all, there should be some blood work and possibly urine work that is performed by your physician that you should be requesting, because you want to rule out any underlying factors. So, is there a thyroid disorder or a parathyroid disorder? Do you have celiac disease? Are there certain other conditions that could be leading to this? And also, are your bone markers at an unusual rate for bone loss, or are you not even forming enough? So these are some of the things that we advocate that you learn about and then have discussions with your physicians about. And then after that, that's the very first thing. And then the other two elements along with this, aside from treatment that a physician may or may not prescribe, and it may or may not be appropriate, the other things are lifestyle choices that are essential no matter what you decide on that element. And that has to do with your nutrition and your exercise, as well as certain things that need to be cut out immediately, like smoking. So that's going to be like one of your first things. And then also then understanding, okay, beyond these exercise elements and how I can change and work with my diet to optimize my bone health, what else is there that I might be doing in my life that could be other habits that I could change? And then what is my actual risk factor? So you can find out more of this there's a couple of algorithms out there where you can punch in some of these numbers and some of your history, as well as your lifestyle elements that can predict, say, a 10-year fracture risk.
Interesting. Okay. And then is a piece of that a DEXA scan, or are there other tests to perform or tests to look for or request?
Yes. So the DEXA is the actual test that is the bone density scan that will have given you that initial diagnosis of osteoporosis, unless you even had a fracture. If you've had a fracture, then that actually classifies you already as osteoporosis. Now, we're talking about in recent years, and most specifically a fragility fracture from a standing height. So not talking about a car accident. That becomes it gets into a little bit of another blurry area, but specifically that alone means you have osteoporosis if you had that fracture. So it's not even just on that DEXA alone. So what I'm referring to are certain tests. One is called the CTX. So this is a test that will identify if you're having unusual bone loss, for instance. And that's a really good test, especially if you're about to go on treatment, like say with a medication. It's not only to identify other factors going on, but it's important to use to monitor your treatment, to look at the efficacy in addition just to looking at the bone density, because there are shortcomings with just the bone density scan, the DEXA scan, especially for followers of yours with arthritis. So you can get a false reading. If you have arthritis in your spine, you can actually get a false reading on a DEXA scan. and not necessarily a
Interesting.
favorable way. It can actually make it look like your bone density is higher than it is. And I've had this with patients and clients I've worked with, where I had somebody, I hadn't seen her in a couple of years. She would fly in every so often to work with me. And it was a couple year span, and her bone density was pretty low, and previously, and all of a sudden it just jumped up. I mean, this exponential change, and I was suspicious, and sure enough, it was arthritic readings that were coming across through calcifications in the DEXA scan. So you got to
Very
keep that
interesting.
in mind. Yeah.
Yeah, absolutely. And so then the CTX would help to kind of hone in on some of that, or does the arthritis kind of carry over to that one too?
No, not that I know of. No, the
Okay.
CTX will just identify, without getting too technical for everybody, it will help you identify unusual bone loss. So osteoclast activity, they're the bone breakdown cells, basically. If those are going into overdrive, then you're going to have more bone loss than you want.
Got it. Got it. Okay. And so another common question that I've seen is medication required, or are you able to conservatively manage osteoporosis, osteopenia?
It just totally depends is the answer. So I'm a kind of middle of the road gal. I am not completely anti-medications because I do believe they have a time and a place. But I'm also not somebody who says, yeah, just write me a prescription and let's be done. No matter what, first of all, even if you are taking a medication is not going to help your balance, right? So only practice of movement and exercise, which you and I try to explain to people can be enjoyable and fun, only that is going to really improve your balance. So practicing the thing that you're trying to improve. But so it depends. Sometimes medication is appropriate. And especially if somebody has fractured, that's a time to really take it more seriously. Also, it depends on your age. So age is probably the biggest factor, aside from having had a previous fracture, of a future fracture. So the higher you are in your age, the greater your risk. However, there's a much greater discussion than has been involved publicly about hormone replacement therapy. That, it's always been, in terms of osteoporosis treatments, it's kind of like, the little long lost sister in favor of others that you've probably seen commercials about. However, there's a greater discussion now about hormone replacement therapy, and especially in the first 10 years after the onset of menopause, and how much that can reduce people's fracture risk. Always something to talk to your doctor about. I'm not saying that everybody should go on it, but it's something to have that discussion with your physician. So that's something that really wasn't widely discussed in past years. So are there cases, though? Absolutely, where people can improve their bone density without medication. I mean, I did. However, I also give the caveat that I was and am still premenopausal, in fact, perimenopausal now. And so the amount of estrogen in your system increases the bone retention possibilities that you have. So it just depends on your history, your medical history, including what medications you've had a history of taken, because certain medications like glucocorticosteroids induce your bone loss, like prednisone. And it also, there's a whole bunch of factors that come into play. So I think it's very individualized, but can you increase your bone density without medication? Yes, you can. And until recent years, it was only thought that you could do that in a premenopausal state. And we are finding and identifying that you can actually increase your bone density post-menopause with osteoporosis, but there's a lot of factors that have to be considered.
Absolutely. And I think that it's also important to note the power of movement. And
Mhm.
and that's kind of why I think, as far as the correlation between osteoarthritis and osteoporosis, that through the research I was looking at, there's not particularly like a specific correlation, but if you are listening and have osteoarthritis and have dramatically reduced your physical activity, which happens a lot of times when you're in pain, especially, you've been dealing with pain for years, people just dramatically decrease their physical activity out of fear of making their osteoarthritis worse or continue debilitating pain, whatever it may be. Then you open yourself up to getting osteoporosis. And I actually did an earlier podcast episode on this as well. And I want to get your perspective on how to approach exercise if you have osteoporosis.
Sure. And you're so right. There's not I may have used the word correlation. There's a relationship between the two, as comorbidities often existing in more often than not in an over 50 population. But, I've had arthritis for years myself, so it's so different. But yeah, there's a relationship because of the population, but one doesn't cause the other. So I'm glad you mentioned that. And what you said is perfect about that. That reduction in exercise is a risk factor for osteoporosis. So where should you start? Well, this, without plugging myself, this is something that we actually have been working on because the Buff Bones program is really how you organize and prepare your body for the heavy loads that you do eventually want as much as you can to add to your bones, because bone responds to outside forces. So the more of these outside forces you put on your bones, on your skeleton, lifting, pushing, etc., the more possibility you have for what we call osteogenesis, or this bone formation and bone remodeling that needs to happen. And so the challenge, though, is that people should not just start off trying to do, deadlifting half of their body weight. You have to have good mechanics. You have to have healthy form so that you don't actually do more damage than good and injure yourself. So, we created a 10-day challenge as the original starting point to help people with osteoporosis of any age. And actually, really, a lot of our population is midlife, is actually my age. And so and then that's the other thing, is that, are we talking people with what level of function? Are we talking a senior population, or are you talking a midlife population? And there is a distinction depending on their function capacity. But my mom, for instance, who's been just left today, she was visiting for the last 2 weeks, 76, and incredible shape because she's been diligent for decades on doing things. So, she's an example of a senior population who does our most advanced level classes. So, there's all these factors that we have to bring to play, but before somebody adds in the loads that the research has shown are necessary for these bone density improvements, you have to organize the body. And especially if there's any underlying conditions, which most of us have, I can think of 4 for myself, 5 that I could list right off the bat. You have to address those and any kind of compensations that play out in the body as a result. So that's where you need to start, is with your foundational element before you start bringing in the outer loads. And then it's not only just about strengthening your bones, it's about your balance, it's about your reflexes and how quickly you can respond, we call it reaction time. And then not just agility, your speed, but mobility. How well do certain joints move? And especially if you've had osteoarthritis, I've got plenty of it myself. I can relate. It's like certain things are painful and you either don't want to do them or you're very slow in doing them. And it takes a dedication. That's all I can say, is it really takes a dedication to your body and a desire to make things different. And you're always telling your people that's possible, but you have to dedicate yourself to it.
And I mean, that dedication piece is incredibly important in terms of consistency. And, I always had people ask, do I have to do this for the rest of my life? Do I have to do it came in the form of, do I have to do my PT exercise for the rest of my life? And before I started this business, and the answer is yes, but it doesn't have to be the sense of like PT, or they don't have to be boring. And you want to make sure you're not doing the same things, which I think is so important to understand the why behind things. So you're not just, doing things because somebody told you to do this one movement. If you understand that, in the sense of, if you have osteoporosis, that you're building your bone strength, rebuilding bone density, and in the sense of osteoarthritis, that you're able to support the joints and you're able to move optimally. And if you don't have osteoporosis but want to prevent it, I mean, it's the same thing. You have to dedicate yourself. And this is something that's not just for the next couple of weeks. This is something to continue for the rest of your life if you want to continue to do what you're doing now and you want to continue to move well. But it is something that you have to find something that you like to do, something that you can be consistent with, because it's not just something that's just done and over with and then you don't have to exercise again. I mean, there are so many other health benefits.
And it's exactly, you hit on it with another thing you said about when you asked at the beginning, is this something that I have to do for the rest of my life? No, it's something that you get to do.
Exactly. Yes, I love it. I love it.
But I think that's part of the challenge, is how do we reframe the mindset? Do you brush your teeth once a year? No, you know that you brush your teeth every day. And this is like your body hygiene. Literally, I have my things that have kept me walking because of my arthritis, and my other issues have kept me going and functioning for the last 2 decades. And without them, I really wouldn't be walking. So I do these things that take more time, but they allow me to live the life that I want to live. And I think that's the thing. And also, like the variety you were saying, like with our online classes, we try to give this variety so that people can have different things that they want to do. And as you're saying, you can't and shouldn't just keep doing the same thing, nor would you want to. That's
Right.
when it becomes a chore.
Some people do. Some people, though, like to stick with the same movement for years and years and years, and they just don't get sick of it. Mainly because I think that you don't have to think about it, that you just know what you have to do. So, but I noticed that a lot when I was practicing physical therapy and home care. We'd have people with these like archaic, like pieces of paper that they got years ago, but they held on to them and they kept doing them every single day.
Definitely seen that.
Yes. And so I think that one thing that I wanted to bring up about, because I had somebody bring this up to me a little while ago, about what it takes to actually build bone. And there's a study, I think it was a Liftmore study, correct me if I'm wrong, but they essentially looked at, had people do exercises to see what their changes in bone density were. And I don't know the details of the study, but I do know the movements that they did, well, the 3 main movements at least. It was a squat, a deadlift, a overhead press, and
a jump drop.
Yes, okay, and jumping. These were with like barbells. These were not with, 2-pound weights, 3-pound weights. And someone was like, wow, I was so amazed that they used barbell, like they had weights and things. And so somebody had brought that up, which is interesting. So I'm sure that somebody listening or watching is, when you think about resistance training, I mean, heck, when you Google it, you see people with these little pink weights and, all of these things, especially if they're older, they have all these tiny weights. But that's where you can start, absolutely. But we have to be able to increase the weights and be able to get into an area where you're actually loading your body and using a weight vest and things like that. And so what are some ways that I know, people obviously don't have barbells at home. What are some ways that you help people load and help people reach some adequate resistance? I mean, once they've mastered the basics, how can people add resistance at home? I'd like to get your perspective on that.
Yeah. So first of all, I have to give you a little disclosure. It's funny. You may not know this. It is the Liftmore trial, and they actually conducted a study that they published last year 2021, we're no longer last year, comparing their protocol to Buff Bones. So I should,
Oh, interesting. Okay.
yeah, it was very interesting. And there were two things that they were looking at, there were two outcomes. The primary outcome was looking at bone density, and the secondary outcome was looking strength performance measures. And not surprisingly, because remember, or I shouldn't say remember, for your listeners, you should know that Buff Bones is a program that you can do at home or take classes in a group setting. It is not something that is specifically with a gym. And in order to get the kind of loads that you're referring to, Alyssa, is going to be with 80 to 85% of 1 rep max, which means
Which is a lot.
yeah, the most you can do of a single squat with your, with your barbell, and the most you can do with one, you do 80 to 85% of that weight. And so this is not something you ever would do unsupervised or without having been trained in this. And at a gym, you cannot replicate that at home. So the challenge is, there's an accessibility to the gym, and there does create a socioeconomic disadvantage. But if you
And I have a lot of people that don't like the gym. So
on top of that, yeah.
yes.
So the reason I'm mentioning this is they were comparing that to Buff Bones. And when you're doing something with what they used was the protocol of our 2 to 3 pound weights. And that we're just at the end of the class, because our focus is not actually bone density specifically. It's all the other elements that lead up to it, and that, you'll get some benefit from, but the research has shown for years, you need these heavier weights. So I want to just clarify what the distinction, though, was in the secondary outcomes. The measurements that they were looking at were greater for them, but there were still the statistically significant improvements for Buff Bones in function and muscle strength. So both have research behind them. They're very different movement systems. So essentially, what should somebody do at home? This is essentially what Buff Bones is. What should you do after, you've built up yourself to do the heavy loads? If you can make it to the Lift More style protocol at that load, that's great, but that's not obtainable for a lot of people. So that's why we have what we do. And so we have a whole system and method of organizing the body so that we release the restrictions in the connective tissue, which is where you feel your sense of stiffness usually. We organize the nervous system in the motor control, in other words, the way that your nervous system dictates your muscles, how and when to contract, and the precision and timing. And we work through mobility and other elements of full body muscular strength and balance. And then at the end of the class is when we add in the external load of weights. And so we'll add in, 8 to 10 pound, or what is it, about 16 kilo or so, doing things like goblet squats and deadlifts or overhead press, and some of these things that are strength training moves, but along with other elements that you're probably not going to see necessarily in a strength training capacity that are more functional, put it that way. Very functional style movements and punches and balance and dynamic balance elements. So like you're bringing in all these things. So you can use, the weights that you have, but other things that I use in teaching classes, and I have some on our videos, is I take my Instapot and I just fill it with stuff. So again, you're not going to be able to replicate like a back squat, putting something like that behind you, but you can replicate something like a goblet squat where the heavy load is actually really close to your chest. And so loading up the items that you have are going to be really useful. And there's different ways you can play with bands as well. The thing is, bands can give you that muscular resistance, but they're not going to give you the external load. And if you're at a loss for time, you're probably going to get more bang for your buck in terms of that bone density by bringing the external loads.
And I do think that weights are certainly important. And I mean, it's just getting to that resistance point. So no matter where you're at, if 2 pounds feels heavy for you, that's a great place to start. But I think a lot of people get stuck in that's their comfort zone. And so that's where they
Mm,
stay.
right,
And
right.
so I absolutely agree. There is lots of different ways to get creative at home and lots of different ways. Because I meet people all the time who say, I have no desire to step foot in a gym ever, which is totally
Right,
fine. There are
right.
totally other ways and so many people are getting creative out there. There's so much different equipment that you can just get at home to easily, like sandbags and sandbells and stuff, that you can very creatively add this load at home. And so,
Yes.
in wrapping up, I just kind of want to give the listener or the watcher just some final words that if they have been diagnosed with osteoporosis, or perhaps if they want to prevent it, what is maybe a one or two things that they really should prioritize at first?
I think one of the first things to prioritize, like, is just going back to what you and I have been saying about exercise and movement, that no matter what your level is, there's always a place to start and there's always room for improvement. So you can improve your body no matter what. So I would say that is the first thing. And especially, as you were saying, whether you're using a 2 pound weight or whether you're using a 15-pound weight, and it depends on the exercise, right? If you have a long lever and you're lifting your arms out to the sides, you're going to need a lighter load than something that is like a deadlift or a squat where it's close to your body, where the whole weight just transmits through your body and doesn't take the strain onto your shoulders. So, but there's always something you can do, whether or not you're taking a medication. And so that has nothing to do with your quote treatment intervention that you're using. This has to be part of it. And the balance must be an element as well, and the coordination and that mobility component. The second thing is to remember a distinction that just because you have osteoporosis, it doesn't mean you're going to fracture. So unlike arthritis, there is no pain that is associated with osteoporosis unless you've had a fracture, or you've had a fracture and the fracture itself is not the pain, but you've had so much compression from the fractures in your spine that there's a shortening of all the tissue around it that could give you pain. But osteoporosis itself doesn't hurt. So you don't really know that you've had osteoporosis unless you get a diagnosis or you've had fractures. And the important thing is that just because you have osteoporosis diagnosis, say from a DEXA scan, it doesn't mean you're going to fracture. You might actually have decent bone quality that is not detected on that bone density scan known as a DEXA. So stay hopeful and recognize that no matter what a physician may tell you of, oh, you have the bones of a such and such year old person, get some more information. The story does not stop there.
And I think that that's so important. And that's the whole goal of this podcast, is just to bring more awareness to certain topics, open up the dialogue with healthcare professionals, understand how to advocate for yourself, understand what to ask about, and really just get some different perspectives on some different conditions. Because just because one person says something doesn't particularly mean that it's true or that it's the only way. It's always great to get some different perspectives and some different opinions on how to go at a condition, especially when it comes to osteoarthritis and osteoporosis, two things that can be improved with movement, and that exercise plays a very powerful role in. And so I want to thank you so much for joining us. And if people want to find out more about you or more about Buff Bones, where should they go?
They can go to our website, which is buff, BUFF hyphen or dash bones, BONES.com. And on Instagram, we are at Got Buff Bones. And this year we will have our new YouTube channel. So stay on the lookout for Buff Bones.
Amazing, amazing. Thank you so much for joining us.
Thank you for having me. It's been really fun speaking with you, and I appreciate all that you offer all your listeners and all your followers. So I'm thrilled to be working with you.
Yes, absolutely.